Here we are in the calendar's just clicked over to December. We don't have a legislative session this month, but we do have David Eby out there talking and raising alarms about the new president in the U.S., Donald Trump, and his threatened tariffs. What's been happening since that threat first surfaced?
So it came as a shock to everyone. I think we can say that without any worry of being wrong. I don't think the Prime Minister Justin Trudeau or Premier David Eby or anyone else in this country saw it coming. We had heard that Trump was talking about imposing 10% tariffs across the board, so we were sort of preparing for that. And then he came out and said that there were 25% tariffs that he was going to levy on Canada and Mexico if we didn't fix the border and stop the flow of fentanyl. We all know the Port of Vancouver ports in BC are rampant with precursor chemicals. It's been a hot topic for a while about whether we should bring back port police that the federal government scrapped in 1997. There was another program that was run by the regional district that was scrapped in 2005, I believe it was. And so now there's clamors to bring it back. Premier David Eby has talked about needing to have a united Canada front. The premiers have met. Prime Minister Justin Trudeau flew down to Mar-a-Lago to meet Donald Trump and have dinner with him. And so the discussions are ongoing. There's a lot of talk about how this might be the opening salvo in a negotiation. It might also be a tactic. Trudeau was told that it is a way that the Trump administration will try to bring their budget into line, and then they might be willing to strike one-on-one deals with specific countries. But it seems that Donald Trump is very concerned about the perception that drugs and people are being smuggled into the U.S. From Canada. Certainly, we don't know what's going through our ports because only about 2% of all the materials that go through our ports and shipping containers are checked every year. And so it's really created a discussion. BC Conservative leader John Rustad has called for Eby to bring back the legislature on an emergency basis to pass emergency funding to bring back a port police at a provincial level. I know it's federal jurisdiction, but get that money out and then send Ottawa the bill for whatever that costs. Premier David Eby has stuck to his timeline that he said the provincial government will not resume sitting until February 18th, with budget day coming on March 1st. But I think it's all up in the air and nobody really knows how to respond at this point. And everyone's holding their breath to see whether Donald Trump actually pulls the trigger with that tariff threat come January.
Which BC products would be most at risk here with the tariff threat?
Some that come to mind. BC is actually in a better position than a lot of other provinces. Now, that's all relative. We do half of our trade with the U.S. compared to over three quarters, the over three quarters that Canada as a country does. But softwood lumber is a big one that's being already tariffed to high heaven. It's currently 14% tariffs. 25% tariffs would lead to more mill closures, more job losses like we've already seen. Our natural gas sector, that's another big one. Our mining sector, Premier David Eby has talked about building up critical minerals. That could be majorly impacted by tariffs if those minerals that are needed for, say, electric batteries for cars. The auto industry in Ontario and Quebec would be decimated by those tariffs, but we also don't often talk about our own role in that, which is in the push for electric cars, which I imagine Trump will backtrack on. But in the push for electric cars, we need critical minerals. We need all these things to compete against China, which is oftentimes one of the biggest producers of some of these minerals. So that's another industry that will be major impacted. So we've got forestry, we've got natural gas, we've got mining, shipping, the shipping industry, the retail industry. Everything will be impacted. It's a matter of magnitude for each industry. But regardless, we're going to expect major economic headwinds or possibly even economic collapse in some sectors if those tariffs go ahead.
Right. We saw this last time with Trump when he promised these universal tariffs, and then he very quickly and his team granted thousands and thousands of exemptions for companies looking to bring things in. I guess one of the big one being steel from Canada that was exempted. So you don't know, as you said, whether this is a negotiating ploy, because you can't imagine he wants to hurt his own economy by a high tariff on gas, for example, or softwood lumber is going to hurt, you make their own economy more unaffordable.
Yes, but I also don't know if Donald Trump can be expected to avoid cutting off his nose to spite his face. And I think in some cases, he's looking at this as an actual tactic to bring down costs, to bring down, he thinks that, he really does believe that tariffs are an option as a policy to bring about other things. Now, we may see that here with the bringing back of port police. Maybe that's enough. Maybe he just wants a win to be able to say we've reduced the amount of fentanyl, other drugs that are going across the border into the United States before he takes office. And then he'll say, oh, we're just going to slap, say, 10% tariffs, what we had talked about previously. I don't think Prime Minister Justin Trudeau was told that we can't avoid tariffs in the short run. And so that makes me wonder whether it's going to be the full 25% tariff or whether it's going to be the 10% tariff. And I think a lot of that is down to not necessarily people clamoring about the impact that would have on the American economy, because I think Donald Trump is going to move a protectionist agenda regardless of what people tell him. He's not a free trade Republican in the sense that many have been for the past several decades. And so I think protectionism is still very much going to be the strategy. It's how badly we're hit with tariffs, whether it's the 10% or the 25% that he's threatened.
All right. Moving closer to home, with the legislature now not sitting till mid-February, we know you've written about, your colleague Vaughn Palmer has written about the delays in getting the $250 or $500 checks, $1,000 checks out to people, depending on what they're eligible for, $500 to $1,000. So that's going to be delayed. But what's happening, let's say, on some other big issues, like on the healthcare front? What can the new health minister do in the absence of legislative authority?
We're not quite sure at this point what the plan is for Health Minister Josie Osborne. I know she's been speaking to a bunch of different healthcare groups, as have all the ministers since cabinet's been appointed. They've been making the rounds to sort of see what the needs are, what the asks are. But on the healthcare front, it's going to be a tough issue because, we're going to continue. I imagine we're going to continue to see ER closures, especially in the north and interior throughout the winter. That's not going to be a quick fix. We need to build up capacity in the system, which means training, which means bringing in new physicians, new doctors. And, the College of Family Physicians here in BC has said that 40% of family doctors are either thinking of retiring or reducing their hours in the next 5 years. A large part of that is overhead. So that's one part that they can tackle that Premier David Eby came around to during the campaign, talking about the need to axe the facts, so to speak, and make other changes to how physicians handle paperwork. There's also the case that, the benefits and pension plans for family physicians are either non-existent or not as good as a lot of other people in the system. That's another complaint, but I think that's secondary to the bureaucratic nightmare oftentimes that a lot of family physicians go through. That's going to be a key issue. We've got a new medical school opening at SFU sometime in the next few years, but that's still going to take 4 years past that to even train new physicians. So, there's talk about further increasing spaces at UBC Medical School. There's talk about further streamlining, and I imagine this will need to be done legislatively or through discussion with the colleges, who have been, quite frankly, reluctant to streamline international credentialing. I think that's a process that got started over the last couple of years, but one that will need to be accelerated. if we're going to bring more people into the system. And it's a whole bunch of different areas. The health system is bureaucratic, it's complex, it's hard to get anything moving through it. And especially for a brand new minister. Now, Osborne was well regarded in many respects in some of the energy file. In other areas, maybe not so much, but she's certainly, I think Premier David Eby considers her a capable minister, and it'll be interesting to see how she puts her own stamp on a ministry that has very much been the domain of Adrian Dix for the last 7 years.
Well, on top of all of those challenges that you've articulated, she inherited through the deletion of the Mental Health and Addictions Ministry, all of those issues as well. And one of them that Eby promised during the election campaign is an expansion of involuntary care. Is that something we're seeing any evidence of yet?
Not yet. I imagine we will need to wait until the new year to see what that looks like in practice in terms of the...
Why do we have to wait for the new year?
Because I imagine they're still trying to figure it out. It very much was a flip. Mm-hmm. They want to call it a pivot, but it was very much a flip right before the election campaign.
Right.
In terms of, I know they want to open more redfish centers. I know that's been a priority for a while. We have yet to see evidence of how fast that is moving forward. We've got the, continuum of care, the Road to Recovery program at St. Paul's Hospital that's sort of now up and running, but that's not part of the involuntary care plan. And so we will have, I imagine there's going to be very little progress on that because it's going to be such a big thing to bring in over the next month. I imagine we might see some movement on that in January, starting in January before the, before session starts, before the House starts sitting. I don't know what that will look like. It's still very much up in the air, I think, at this point about how the government is going to go about doing that. It's all great and well and to say, oh, here's a promise that we're going to do. We're going to expand involuntary care, as we've seen with the promise to create more treatment beds and more recovery services by the province. That's sometimes easier said than done. And so I'm waiting to see. The transparency around all this process is also not high. And that was the case with the Mental Health and Addictions Ministry. We didn't know oftentimes where new beds were being placed. It's like, oh, we've created this many new beds. Well, where are they and how are they operating? How are they being, staffed? All those sorts of things that we didn't hear about. We heard, oh, there's a month wait for treatment, and that's hopefully, by bringing it back into the health ministry, it rebrings the policies with the money, because that was one of the big problems with MMHA, the ministry, the separate ministry, was that, the money remained in health, but the policies were all going out through the Ministry of Mental Health and Addictions. Hopefully by bringing them back together, it streamlines the process. But especially for a new minister like Josie Osborne, who has to deal with the complexity of the health system and begin, I imagine her briefing sessions are crazy because there's so much to know. It's by far the largest ministry in the government, takes up, I think, 40% of the provincial budget. That's not including the reintegration of the Ministry of Mental Health and Addictions. And so it'll be interesting to see how soon we see action on that. But I imagine going into the Christmas season, which is generally pretty sleepy to begin with, that a lot of ministers will take this as an opportunity, especially someone like Osborne with the size of her file, to really dig in, get to understand what's going on in the ministry, and then go from there.
All right. Well, we didn't even get to talk about housing, but let's save that one for next week.
Sounds good.
All right. Thanks, Alec.
Thank you, Harold.